And right now we are in Greenville, and Dr. Cedrek McFadden is joining us to answer your 7 News medical questions as we get those questions from Facebook, so you can go on there and add yours to the list. But Linda is starting us off today asking, if people don't follow the guidelines out there, does that delay the end of the virus?
Potentially it can, because the guidelines are there to decrease the transmission of this virus. It's spread primarily from person to person. We saw the CDC recommendation says it's less likely to be from surfaces, even though that's still important to wash. But it's still that interaction from person to person that can increase and continue to encourage that spread, which is why social distancing is still important, even where we are right now, even down from the peak. That's still very important.
All right, latest on the vaccine. A lot of folks asking about the timing and the prospects for it. Is it looking good?
It's looking, folks are very optimistic. It's still a lot of work. A lot of things still have to happen outside of the lab to make this happen. But some of the early numbers look like perhaps by early fall we'll have emergency use vaccines. Hopefully by the beginning of the next year we'll actually see a vaccine available, certainly for frontline or those people that may be more vulnerable, like the elderly or the healthcare workers.
And the number of fluctuations that we see as the Department of Health and Environmental Control puts out the numbers on a daily basis. And sometimes, I think over the weekend there was one day that was like 240 something,
Yes.
and next day it's like 90. How does that happen? Why does that happen?
So the numbers that come in don't reflect the trend. That's just one day in time. In order to look at a trend, you have to look at several of those days. That's why it's hard to make decisions based on what you saw on one day. You have to look at what's happening over the several number of days leading to and after that. Some of that comes down to testing. We're seeing a lot more testing done, whether it be with DHEC, whether it be with some private organizations. Encouraging people to get those important tests is going to help us get back to normalcy, or whatever normal may be. But that number is going to fluctuate based on when that testing is done and how rapid we can get the results back from those tests.
And on the line of testing, Jane is asking, will DHEC come out to areas like Abbeville? I mean, will there be more free testing available? I know we announced some of those spots on Carolina's Family at 4 today, but is more of that expected? We're
going to continue to see that, especially as we reach these vulnerable places, these people who may not have access to healthcare practitioners, getting to them before they can get to us, to provide them the tests that they need to make sure that they're being safe as well.
All right. Cedrek McFadden, always willing to answer your questions. Yes. You can add your questions to the list. He will be back on Thursday to do this once again. Thank you, Doc.
Thank you.